If you've been following mental health trends over the last few years, you might have heard about the buzz around psychedelic-assisted therapies. It sounds like something out of a 1960s counterculture story. But today, psychedelics like MDMA and psilocybin are emerging as promising treatments for mental health conditions that have stubbornly resisted traditional therapies. As of 2025, this isn't just fringe science anymore. Psychedelic medicines are moving closer to FDA approval and could soon be a mainstream option for people living with PTSD, depression, and other tough-to-treat disorders. Let's unpack what these therapies are, how they work, and why so many experts are excited about this new chapter in mental health care. What are psychedelic-assisted therapies? At their core, these therapies use psychedelic substances in a controlled therapeutic setting to help people break through mental health barriers. It's not about recreational use or casual experimentation. It's clinical, guided, and designed to trigger deep healing. The two stars of the show right now are MDMA, 3,4-methylenedioxymethamphetamine. Known popularly as ecstasy, MDMA is being studied for post-traumatic stress disorder, PTSD. Psilocybin, the active ingredient in magic mushrooms. Psilocybin is gaining attention for its ability to treat major depressive disorder, MDD, especially when traditional antidepressants fail. Why are these drugs different? Traditional mental health medications usually involve taking pills daily to manage symptoms, like antidepressants or anti-anxiety meds. They can work well for some people, but not everyone, and often they take weeks or months to kick in. Psychedelic-assisted therapies take a different approach. They involve one or a few sessions where the psychedelic drug is administered in a carefully controlled environment. Guided psychotherapy alongside or following the session to help patients process the experience. The goal is transformational healing, often producing rapid and lasting symptom relief. MDMA for PTSD, healing trauma from the inside out. Post-traumatic stress disorder, PTSD, is a condition that develops after experiencing or witnessing traumatic events, like accidents, combat abuse, or disasters. Symptoms include flashbacks, nightmares, anxiety, and emotional numbness. While many treatments exist, some people don't respond well to current options. This is where MDMA-assisted therapy comes in. How does it work? MDMA helps patients by increasing feelings of trust, safety, and emotional openness, reducing fear responses, so traumatic memories can be revisited and processed without overwhelming distress, enhancing therapeutic connection and insight during psychotherapy. What's the evidence? Clinical trials led by organizations like MAPS, Multidisciplinary Association for Psychedelic Studies, have shown remarkable results. In Phase 3 trials, about 67% of participants no longer qualified for PTSD after MDMA-assisted therapy, a huge improvement over traditional therapy alone. These effects were sustained months after treatment. The FDA has granted MDMA breakthrough therapy status, speeding up its review process, and approval decisions are expected by late 2025. Psilocybin for depression, a new hope for those who've tried everything. Depression affects millions globally, and while antidepressants help many, up to 30% of patients have treatment-resistant depression, meaning they don't get better despite trying multiple meds. That's where psilocybin is showing promise. How does it work? Psilocybin causes temporary changes in brain activity that can break negative thought patterns, enhance emotional processing, spark feelings of connection, meaning, and hope. Like MDMA, it's paired with psychotherapy to integrate the experience and build lasting change. What's the evidence? Research from institutions like Johns Hopkins and Imperial College London has found that a few sessions of psilocybin-assisted therapy can produce significant reductions in depressive symptoms, sometimes within days. These effects can last for months, which is a major advantage over daily antidepressants. The FDA has also given psilocybin breakthrough therapy designation, and final approval is expected around late 2025 or early 2026. Why are psychedelic therapies gaining popularity now? Several factors are converging to push psychedelic-assisted therapies from taboo to mainstream. Number 1. Strong scientific evidence. Decades of stigma slowed research, but now well-designed, controlled clinical trials are demonstrating safety and effectiveness. Number 2. growing mental health crisis. With rising rates of depression, anxiety, and PTSD worldwide, there's urgent demand for new, more effective treatments. Number 3. Changing public perception. Public attitudes toward psychedelics are shifting, and more people are open to alternative therapies. Number 4. Regulatory support. Breakthrough therapy designations and FDA fast-tracking signal growing acceptance by health authorities. What to expect from psychedelic-assisted therapy? If approved, these therapies will likely be clinician-guided. Patients won't just take a pill and be done. They'll have multiple therapy sessions before, during, and after drug administration. Highly controlled, treatment will happen in specialized centers or clinics. Potentially expensive at first due to the intensive therapeutic process, but the payoff could be lasting mental health improvements after just a few sessions, a game changer compared to years of daily meds. What are the risks and limitations? Of course, these therapies aren't for everyone. Potential risks include intense emotional experiences that can be challenging without proper support, side effects like increased heart rate, anxiety, or nausea during sessions, not suitable for people with certain psychiatric conditions, like schizophrenia. That's why therapy is a crucial part of the process. It helps keep patients safe and supported. The future of psychedelic medicine. Looking ahead, psychedelic-assisted therapies could expand to treat anxiety disorders, substance use disorders, obsessive-compulsive disorder, OCD, end-of-a-life distress, and terminal illness. Plus, ongoing research may develop new psychedelics or combinations that are even safer and more effective. We're standing at the brink of a mental health revolution. Psychedelic-assisted therapies like MDMA for PTSD and psilocybin for depression are rewriting what's possible for people with conditions that once felt hopeless. While more research and regulatory approvals are needed, the future looks bright. These treatments offer a chance not just to manage symptoms, but to heal deeply and transform lives. If you or someone you know is struggling with treatment-resistant mental health issues, keep an eye on these developments. Help is evolving in ways we couldn't have imagined a decade ago. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.